Hi, my name is Linda. I am not a medical professional, and the information in this video is for information only. If you have any worries about your condition, you should consult with your healthcare professional. In this video, I will explore how to live with arthritic hands and fingers, their impact on daily life, how to cope with chronic pain, and much more. But first, I will explore the different types of arthritis that can develop in your hands and fingers. Living with arthritis in the hands and fingers can greatly impact your daily life, but understanding the condition and adopting effective management strategies can help you maintain your independence, reduce pain, and preserve hand function. Arthritis in the hands and fingers can be debilitating, affecting one's ability to perform everyday tasks like gripping, typing, or even dressing. Several types of arthritis can impact the hands and fingers, most commonly osteoarthritis and rheumatoid arthritis. Both conditions cause pain, stiffness, and swelling, but they differ in their underlying causes and patterns of joint damage. Arthritis in the hands and fingers includes joint inflammation, leading to pain, swelling, stiffness, and reduced mobility. The two common types of arthritis that affect the hands and fingers are: Number 1 is osteoarthritis, a type of arthritis called wear and tear. Over time, osteoarthritis wears away the cartilage that cushions the joints, causing the bones to rub against each other. When this happens, you will hear crunching and creaking noises as you move the affected joint. This leads to pain, swelling, and stiffness. Osteoarthritis commonly affects the base of the thumb, the end joints, and the middle joints of the fingers. The second is rheumatoid arthritis, an autoimmune disease in which the immune system attacks the synovial membrane, the lining of the joints. This results in chronic inflammation that leads to joint damage, and eventually, deformity. With rheumatoid arthritis, the hands often affect the knuckles and wrist joints, leading to pain, stiffness, and swelling. There is also psoriatic arthritis, which often accompanies psoriasis, a skin condition that causes swelling and pain in the fingers. It can sometimes lead to a swelling of the entire finger, known as sausage fingers. Another one is gout, caused by a buildup of uric acid crystals in the joints. This can lead to sudden, intense pain, mainly in the feet, but can also develop in the fingers. The most common symptoms of arthritis include pain, which is usually worse when you move or after periods of inactivity. Stiffness is especially common in the morning or if the hand has prolonged periods of rest, which can cause difficulty moving the fingers. Swelling is another symptom of enlarged or swollen joints, which can lead to discomfort and decreased movement. Your joints could also weaken, and you may have difficulty gripping objects, opening jars, writing, or holding utensils, which is a challenge. Over time, you may see your joints develop nodes, which are bony growths at the joints, or your fingers wander out of alignment, a condition called deformity. While there is no cure for arthritis, there are many treatment strategies that can help manage symptoms so that you can maintain hand function. They include: Number 1, medications. These could be nonsteroidal anti-inflammatory drugs, such as ibuprofen or naproxen, that reduce pain and inflammation. Creams or gels such as capsaicin or menthol help numb joint pain. Corticosteroid injections, to reduce inflammation directly in the joint. Another is disease-modifying antirheumatic drugs. These are particularly good for rheumatoid arthritis. They help to slow disease progression and reduce joint damage. The last type of medication is biologic agents, which target autoimmune types of arthritis, such as rheumatoid and psoriatic arthritis. Or you can buy over-the-counter pain relievers. Nonsteroidal anti-inflammatory drugs, like ibuprofen, help manage pain and reduce inflammation. But before you buy any over-the-counter drugs, you should consult with your doctor. Number 2, physical and occupational therapy. You need to keep your hands and fingers moving, as this can help maintain your mobility and strength. But it would be best not to overdo the exercises. You need to have rests in between. Occupational therapy. Your therapist can help you learn specific techniques to protect your joints, and you could use assistive devices to make your daily tasks easier. Number 3. Lifestyle adjustments. When you develop arthritis in your hands, you should make small changes to your daily tasks. Some things that can help you manage your symptoms include avoiding overusing your painful joints and modifying activities to reduce strain. For example, you can use larger handles on utensils or tools and break tasks into smaller, more manageable steps. Heat and cold therapy. You could apply a heat pack to your stiff joints. It can help relax muscles and improve blood flow. Or you could use a cold pack to reduce the swelling and numb the acute pain. Healthy diet. Anti-inflammatory foods, such as salmon and walnuts, fruits, vegetables, and whole grains, rich in omega-3s, may help manage symptoms. Listen to the rest of my video, and I will show you more foods to help with your pain and inflammation. Number 4. Surgical options. When traditional treatments fail, surgery may be considered, mainly if joint deformity is severe. 5. Alternative therapies could be acupuncture, a traditional Chinese therapy that can reduce pain and improve function. Massage therapy. Gentle massage can help relax muscles around the joints and improve circulation, but you must see a professional certified person for these. Number 6 is your mental and emotional support. Chronic diseases such as arthritis can take their toll. Managing pain and loss of function can lead to feelings of frustration, anxiety, and even depression. There are some ways to help with your mental health, which include staying connected. You must engage with support groups in person or online. You can get some practical advice from others who understand what you're going through. Mindfulness and relaxation are other ways to manage stress. Meditation, deep breathing exercises, and gentle yoga can help. You can also talk to professionals, such as a counselor or therapist, to get the emotional support you need. Number 7 is that you should stay active, such as swimming, walking, or cycling. They can help maintain overall health and reduce arthritis symptoms. Keep your movements gentle to avoid stressing painful joints. There are a lot of assistive devices on the market today that can help you with arthritic hands and fingers. They include, number 1, you could get ergonomic kitchen tools such as jar openers. Electric can openers can help open cans without applying any pressure or twisting with your hands. Ergonomic knives and utensils have large soft handles that are easier to grip. Some knives have an angled design to reduce hand strain. Or a rocking tea knife. This knife, designed for people with arthritis, cuts food using a rocking motion. Number 2 is writing and office tools. These include pen grips. You can get large cushioned grips that attach to pens and pencils to reduce tight gripping, or an ergonomic pen with specially designed larger, easier to hold grips for more comfortable writing. If you have trouble typing, you could use voice-to-text software. This software allows you to dictate notes, emails, or documents, reducing hand strain. You could get wrist supports for the keyboard. These cushion supports help maintain proper wrist alignment while typing. Number 3 is household tools, which can be doorknob grips. These covers or lever handles for doorknobs make turning easier without twisting your wrist. Grabber tool. These are long-handled devices with a trigger grip that helps you reach for objects that are low on the ground or that you have dropped. You can grab the item without bending or stretching your fingers. There are also large grip scissors with large, easy-to-use handles for people with limited hand strength. Number 4 is personal care devices. They include long-handled shoe horns, which help you put on shoes without bending or straining your hands and fingers. If you find it challenging to do buttons or zippers up, special tools help you fasten buttons or pull zippers without pinching your fingers. Elastic shoelaces. When they are difficult to tie, elastic versions turn any shoe into a slip-on. Electric toothbrushes are powered toothbrushes that reduce the need for tight gripping and manual brushing motions. Number 5. Cooking and eating aids. Adaptive eating utensils, such as forks, knives, and spoons, can help grip the handles. They have built-up or contoured handles that are easier to grip. Cutting boards with spikes keep the food in place. so you don't have to hold it down while cutting. Lastly, ergonomic vegetable peelers are designed with larger handles to make them more accessible to the hands. Number 6 is grip aids, which can include hand splints and braces. They can support and reduce the strain on your fingers and wrists. Adaptive grips for tools are also helpful. They are attachments to items like hammers, gardening tools, or brooms, and these reduce the need for tight gripping. Instead of twisting and turning taps, there are lever taps or faucet grips. These are faucet handles with a lever design, which reduces the need to twist and turn. Number 7, in the bathroom, you can get grab bars for around the toilet, bathtub, or inside the shower. These can help you maintain balance and avoid straining your hands when rising or sitting. For bathing, there are long-handled sponges or brushes that can help with washing without gripping tightly or straining to reach your back and feet. Shower chairs can help if you have trouble standing for a long period. Number 8 is gardening aids. If you like gardening, some ergonomic gardening tools with padded, large handles reduce the need for gripping. These can include ergonomic trowels, pruners, and weeders. Number 9 is a computer and phone accessory, including a trackball mouse and a mouse with a ball that you roll with your fingers or palm, reducing the need for wrist movement. Ergonomic keyboards are split or curved ones with a more natural hand position, reducing strain on your fingers and wrists. Phone holders hold your smartphone for you, so you do not need to grip it tightly during use. Number 10 is how to manage your medication. You could get a pill organizer that is easy to use with large sections and easy opening lids. Pill splitters or crushers are devices that help you split or crush medication without using much force. Or you could get an automatic pill dispenser. This device properly releases the correct medication dosage, reducing the need to frequently handle small pills. These assistive devices are designed to ease daily activities and minimize pain and discomfort. Many can be found at medical supply stores or online retailers specializing in ergonomic and adaptive tools. If you have arthritis in the hands and fingers, you can find the correct balance. This can involve a combination of practical strategies and self-care that help manage the pain, protect your joints, and maintain your independence. While arthritis in the hands and fingers can be limiting, it does not have to stop you from living a whole and active life. By combining medical treatments, lifestyle adjustments, and self-care strategies, you can minimize pain, protect your joints, and maintain independence. Living with arthritis means finding what works best for you through medical treatment, practical tools, and lifestyle adaptations. You can continue to engage in the activities you enjoy while minimizing discomfort. By listening to your body, using the right aids, and going to support groups when needed, you can find a balance that allows you to live well with arthritis. As discussed earlier, click on the next video to learn about foods that can help you with your pains and inflammation, and which foods to avoid. Thanks for listening to my video. I am not a medical professional, and the information in this video is for information only. If you have any worries about your condition, you should consult with your healthcare professional. If you found this video helpful, please click the subscribe button to follow my channel and press the bell. If you have any questions, please comment below, and I will get back to you. I hope this video has helped. Good luck.